Good afternoon. Abraham Lincoln once said, "It's better a man be silent and thought a fool than to speak and erase all doubt." I would like to thank my fellow classmates for voting for me so I can erase all doubt. First, I'd like to start by acknowledging Chancellor Durham and our distinguished panel, faculty, staff, the entire graduating class of Allen College 2014. So we have graduated. How exciting is this? No, how exciting is this? I mean, now we have to take comprehensive exams. We have to go find new jobs. I've been away from my old job for the past 3 years while going to school, and in that time, my wife has been the financial supporter of the family. And how does that old saying go? If it ain't broke, don't fix it. My wife thinks I need to go back to work. And apparently she is not the only one. The bank has made it very clear they don't care if you're going to college. They want you to pay the mortgage and maintain a positive balance in your checking account. But I'm sure I'm not the only one that's had challenges through schooling here. I know when I've talked with a few of my classmates, they said that they had some challenges too. All of the stories that I will share with you are true and happen to this class. For starters, a few of my classmates had babies during the program. I know, to think that they learned in nursing school how to avoid that, and it happened anyway. I don't think they take good notes. I know some other people had some funny things that happened to them while they were working as nurses or in their clinical rotations. One of our classmates went to give his patient her morning insulin. When he arrived in her room, he found that she had already eaten her entire breakfast and was now starting to eat the tube of aquaphilic triamcinolone cream on her tray. I'm not sure which was worse, the fact that she was eating the medication or that it didn't taste that much different than the hospital food she just finished. Either way, let's just say poison control said that besides some possible loose stools, she would be fine. Another student shared that while working with one of her coworkers on a particularly stressful day, her nurse friend suffered a heart attack at work. They saved his life, but it ended his nursing career. So, I went and looked up in the Framingham data to see if nursing was a modifiable cardiovascular risk factor, and the jury's still out on that. I personally think it's about the same as smoking, frankly. Here's another story of things we will see as we care for patients. One day a patient came into the emergency department with atrial fibrillation. Suddenly she became unresponsive. One of our colleagues saw that the patient was in VFib on the monitor and quickly put the patches on and delivered a shock. The patient jumped up and yelled out, "Whatever you did there hurt." To which our classmate replied, "Yeah, we just shot 200 joules of electricity through your chest. I'm pretty sure if you shot 200 joules of electricity through my chest, I would have stronger words to describe my experience than 'that hurt.'" This is a family-friendly ceremony, so I won't share those words right now. Another student, and this is my personal favorite, had an interesting patient who presented to the hospital, and the patient had nausea and vomiting that he described as the worst vomiting ever. When my classmate asked why the patient thought it was the worst vomiting ever, he said, "I've never vomited so hard that my teeth fell out. But this time my teeth fell out into the toilet." In answer to your next question, yes, they were in his mouth when he arrived at the hospital. I'm not really sure what the evidence says about cleaning those, but he had them back in there anyway. And since I have dinner reservations, we'll finish with this one. I actually had an experience happen to me that taught me to choose my words carefully. One day, a very nice elderly woman had presented to the clinic, and she was a little hard of hearing, which was fine. I asked if I could listen to her heart and her lungs. She said, that's okay. So after I listened to her heart, I said, now I'm going to listen to your breaths. She looked down at herself and back at me and said, why on earth would you need to listen to these? From now on, I will be saying lungs. Now, we laugh at these stories, but they're all true, and while it does provide some comic relief, it points to the fact that every day we have the opportunity to see people who need help when they have nowhere else to turn. We are the people who care for those patients. We give hope to the hopeless, help to the helpless, blood transfusions to the bleeding, and enemas to the impacted. No, we really do. As you leave here today, know that everything you do, graduates, will make a difference in a patient's life. You've made it this far, now go out there and save the world, one patient at a time. Good luck to all of you, and may God bless the work you do. Thank you.